Good afternoon, everyone. Thanks for joining us. I'm Teresa Freed, Assistant Director of Public Affairs and Communications for Johnson County Government. We have with us Dr. Sami Ariola, Director of Johnson County Department of Health and Environment, and Epidemiology Director Elizabeth Holshoe, Allison providing ASL. Thank you all for being here. But we're going to go ahead and get started just talking about today's vaccination clinics.
Yeah, thank you. Today's actually Monday, so our vaccination clinic will start tomorrow. We spend Mondays as we've done all day today planning, not just for the clinics tomorrow, but planning for our tactics moving forward. Again, thank you, Teresa, and good afternoon, everyone. Our clinics are running Tuesday, Wednesday, and Thursday, as well as Saturdays as we go. A lot of appointments this week are second dose clinics. We are still expecting to give about 10,000 shots this week. Majority of them are second dose clinic. There are a few appointments there. Lots of appointment opportunities. You can book an appointment, but also for those that are pretty busy or maybe challenges with the internet access or just don't have the time to do the appointment. We have walk-ins now available. It will be available from 9 a.m. to 2:30 p.m. on Tuesdays and Wednesdays. It will be available this week on Thursdays, 3 to 6:30. Actually, moving forward, that's the time that it will be on Thursday. And then Saturdays, and I need this to be clear, that Saturdays from 9 a.m. to 11:30, and for the rest of the month now, we'll have that available for May 15th, as well as May 22nd. I'd like to go over those again. Walk-in clinics are going to be available on Tuesdays and Wednesdays from 9 a.m. to 2:30 p.m. and on Thursdays from 3 to 6:30 p.m. and then on Saturdays, 9 a.m. to 11:30. But that Saturday, I'm qualifying that because the Saturday clinics that we have next couple of weeks are catering to second doses, not a lot of first dose opportunity. However, for May 15th and May 22nd, you have an opportunity to walk in to get vaccinated on Saturday from 9 a.m. to 11:30 p.m. That's at our vaccination clinic in Lenexa. And Elizabeth will also come in as we talk through our tactics moving forward. Mass vaccination clinics have been great, and they're going to continue to be important. At some point, we were doing 3,000 vaccinations a day. Someday, at least once, we actually did over 3,100 shots a day. That was then. Moving forward, while we're running those clinics and perhaps adjusting the hours of those clinics towards the end of this month, we are building capacity for what we call community clinics. These are going to be smaller clinics that we are going to be in the community. That's on top of the many that we have been doing. I do want to reiterate that we've been working with our partners to host similar clinics for our homeless populations, for strategically at different parts of the city, at different workplaces. We are boosting our efforts along those lines and finalizing logistics. We are looking at different programs in the community. We've talked about farmers market at Lenexa and similar things. We've talked about partnering with churches and other, other institutions or programs in the community that host events that have relationships with people. The goal is never change, is to get the vaccine into the arms of as many people as possible. And that continues. We're trying to make it as easy as we possibly can. And people should also always remember that pharmacists are giving out the vaccines. Our other partners are giving out the vaccines. Quite a few primary care providers, independent as well as if affiliated with the health systems, are giving out vaccines. So lots of opportunities to get vaccinated. Light at the end of the tunnel, yet we can see it. Long way to go, Yes, we're not quite there yet. We have a long way to go. We've thrown out the word population immunity or herd immunity. And really that's conceptually, that's a place to get to where we can indirectly protect a vulnerable population and those that are not vaccinated. Give you an example, for polio, it takes about 80%, vaccinating 80% of the population together. For measles, about 95% of the population. What that means for polio then is if we vaccinate 80% of the population, those 20% that are not vaccinated for different reasons, religious or otherwise, we're indirectly protecting them because we're breaking the chain of transmission, the cycle of transmission. Those that are vaccinated becomes a shield around those that are not. So we're not quite there yet. If you do that, you are able to contain the spread of the virus. If we don't get to the population immunity, if we don't have enough people vaccinated for this virus, it just means that it's a virus that we have to continue to deal with. And that's not what we want. The solution to that is near. While we are awaiting authorization to vaccinate our residents that are 12 to 15, there's still a lot of us here that needs to be vaccinated. Take that effort, take that step. For you, out of responsibility to the community. And we're going to have more opportunities to talk. I want Elizabeth to talk through some of those efforts that we are doing towards the community clinics. But I do want to really emphasize to people that the vaccines are here. We have, across the country, we've given over 200 million doses of the vaccine. Across the world, it's even more. And we have examples of countries now, like Israel, for example, where they have succeeded in vaccinating enough people and now have the virus under control and open things up for their residents. That's where we want to get to. We have vaccines that have been proven to be safe, efficacious, and so there is no reason not to get vaccinated. Let's get vaccinated. Let's protect ourselves. Look, the risk is very low for those that are vaccinated when they interact with other people that are vaccinated. The risk is low for you when you are vaccinated, even when you interact with those that are unvaccinated, but the risk is still there. And again, my wearing mask after vaccination is still out of concern, mostly for those that are not vaccinated. And we have children that the vaccines are not approved for, and they still get sick from this vaccine. Elizabeth will talk about some of the data that we're seeing with the cases and hospitalization. It's occurring in non-vaccinated younger people. We're having people in their 20s that are hospitalized. So we need to, first of all, remove the fallacy or the falsehood that it doesn't impact younger people. That's not true. We have been seeing that for the past 1 year. We're continuing to see that. So Johnson County residents, let's get there. Let's get vaccinated. Let's protect ourselves, protect our most vulnerable. Let's get to where we are more back to where we were before, where we can do more things in the community. And we're going to continue to provide opportunities for you to get vaccinated. Elizabeth.
Thank you, Dr. Arriola. Good morning or good afternoon. Happy Monday, everybody. Dr. Arriola is absolutely correct. This virus does not discriminate by age. We do know that older people and those with pre-existing conditions, and those can be any range of things. You know, we talk a little bit about obesity being a pre-existing condition for respiratory illnesses like COVID-19. And in Johnson County, 1 in 4 of our adults are obese. And so that does put people at an increased risk. But even outside of that, we know that COVID-19 has acts differently in kids. You know, in particular, there is a condition called MIS-C, or multi-inflammatory system complex, in children. And we have seen kids who maybe had a really mild illness first with COVID-19 and then a month later be hospitalized with this syndrome. And, you know, talking with colleagues over at Children's Mercy Hospital, you know, through the fall and into the winter when we were seeing a lot of cases, they had a number of children hospitalized from throughout the region, including Johnson County, due to this MIS-C syndrome. And it can cause long-term effects, you know, some heart issues. So people whose valves aren't pushing through enough blood, kidney issues, people who are on steroids, and then it messes with their insulin and their glucose. management. So while the number of kids who have been hospitalized due to COVID-19 is low throughout the entire pandemic for those under the age of 19, it's only right around 40 kids have been hospitalized, so a very low percentage. But as you get up into 20s and 30s and particularly 40s and 50s, those rates do increase for hospitalization. And we also know that with COVID-19, there's also this long COVID where people continue to have symptoms for months and months and months due to that COVID-19 infection. And because we've only known about this virus for about a year and a half now, we're still not sure what those long-term effects truly mean for individuals. So the best thing that you can do is to get vaccinated. And that's even if you've already had the virus. If you've been infected, research shows that the vaccine actually produces an immune response 10 times stronger with the vaccine than it does with natural immunity or natural infection when you get the virus in the community. And that's what can protect you as well as those around you and your loved ones from getting the virus as well. So, I know that people are concerned about the side effects of the vaccine, but oftentimes those really only are a day, maybe 2 if you're one of the unlucky ones. And that's compared to sometimes, like I said, 6 weeks or several months worth of side effects if you're somebody who has long COVID. So certainly recommend going ahead and getting vaccine. As Dr. Arriola said, we have a lot of walk-in appointments, but we are going to try and start shifting our tactics, right? You've sort of seen this where, we had some smaller clinics and now we had our large clinic in Lenexa. And now we're going to be going out into the community to try and really reach people where they are. I think we've moved out from this phase where people are really excited to get the vaccine and they're going to make that appointment. They're going to come in as soon as it's available. And now we're into sort of a group where maybe it's not that they're against the vaccine or even hesitant. It's just they don't have the opportunity. They haven't sort of stepped out of their way to go find the vaccine or find that appointment. So we are going to be working with a number of community partners, faith-based groups, businesses, as well as public events to try and get vaccine out in the community for people who are there and who are interested in getting it. And so a couple of really exciting steps this week that we're going to be taking around vaccines. One is we'll be looking to have a form on our website if you're a business and you are interested in having us come out. There's no guarantees because a lot of it's dependent on our capacity, but we'll have a form for you to fill out if you're interested in having us come to your group or your business to vaccinate a number of individuals. And then the other thing that we're working on is a tab on our dashboard. So we've talked a lot about our dashboard. I go there pretty much daily. We're now also going to have a vaccine tab on there. So you can look at our progress around vaccination, look at different age demographics and how close we are within those different groups to being able to reach that population immunity. So a lot of progress being made, as with everything else in this pandemic. As soon as you figure something out, everything shifts and you have to revamp your plans. But I think by this point, 14 months in, we're getting pretty good at that, pivoting and identifying new solutions. So really excited about this next phase. It's definitely different than what we've been doing, but we talk about making the healthy choice the easy choice, and now it'll be talking about making the vaccine the easy choice.
All right, that's some great information. As you heard, we still have the walk-in clinic available, and just wanted to talk a little bit about what you need to bring if you go to one of those walk-in clinics, especially if you're under 18.
Thank you. So right now, I think the thing we must keep in mind is that earlier on, when we did not have enough vaccine and the state had these different phases and we had to prioritize, we were pretty consistent that was strictly because we just did not have enough vaccine, and we want to be fair to everyone. To make sure that you are only coming if you are eligible. That's gone. We have vaccines. It's been opened up initially to every Kansans. Right now, if you walk in, doesn't matter whether you are from Missouri or Kansas, because the virus does not discriminate as to where you are. And so we're getting people vaccinated, whether they live here or they're visiting. Or if you get your first dose somewhere else. For a long time, we couldn't give you the second dose on a consistent basis. Now we can. To your point about 16-year-old, if you're younger than 18, you still do need a parental or guardian permission to sign the slip. They don't have to be present in person, but they can complete the dispense assist or some other form that's showing that they support that activity, and you can come and get vaccinated. Again, we're trying to reduce obstacles where you don't need to bring to us anything about your medication or medical records. You don't need to give us an indication of your immigration status or anything. Really, for those that are younger, just some parental permission. We're vaccinating people.
We had the opportunity to vaccinate some 16 to 18-year-olds in conjunction with our school districts over the past couple of weeks, which was very exciting. So 2 weeks ago, Shawnee Mission School District immunized a little over 600 of their 16 to 18-year-olds in each of their high schools during school hours, which was very exciting. So sort of the same idea that parents filled out their consent forms ahead of time, and we just had kids come down during certain hours and got them vaccinated. And that was really run by Shawnee Mission School District, with a little bit of assistance from Children's Mercy and ourselves, but all of their nurses were the ones vaccinating. And then this past Saturday, Olathe School District had a clinic, and they vaccinated over 400 of their students on Saturday during the day. So again, the same thing, although some families were able to come and take advantage of some extra doses that they had on site. So very excited to get these groups vaccinated. It really does take everyone to get vaccinated in order to really achieve that population immunity that Dr. Arriola was speaking about.
And it's very impressive, those numbers from our schools, and thanks to the school districts, Shawnee Mission, Olathe, and our staff that are working with them to get those things done. Children's Mercy for facilitating and helping with a lot of those efforts. Those are the efforts that's going to take. It's getting 100 people here, 200 people here, more shots getting into people's arms every day. Different tactics, the same goal.
And I know we've had some questions just about how are we keeping track of where someone gets a shot and if they're completed. I know when I went to the doctor, they already had it in there that I had completed both of my shots, which I was really happy to see. So do people need to communicate that with their providers, or is that already being shared somehow automatically?
I'll start and I'll let Elizabeth jump in. As you can tell, efforts of this magnitude with people sometimes traveling hours to go and get their doses, and people getting doses in vacation spots and coming. Some of those are not as easy or feasible as others, and she'll talk to you about some of what we are seeing with that data also. Nationally, the CDC is reporting that maybe about 8% of people are not getting their second shots. Tough to track because people are getting their second shots in different places. Those systems are not communicating. We know that several of our residents who are vaccinated in Missouri and other states, we don't have access to those information. While I'll let Elizabeth get into the data, I just want to be very clear. You do get some measure of protection from the primer, but that's not enough for those two dose vaccines. That's how they are tested. You do not get the full protection unless you get the second dose. 2 weeks after the second dose is when you get your full protection. And we have seen breakthrough infections in both cases, but a lot of them really are happening after the first shot before you get your full immunity. So for everyone's sake, to ensure that you get the full benefits, even with the few that are seeing the mild side effects, those things they pale in comparison to even the mild form of COVID-19. So take your shot, complete that, so we get everybody ready to go as we do our best to get back to life as we know it. But yes, massive undertaking, tens of millions of vaccinations, different jurisdictions. There are issues with with the data, and so I love that our epidemiologists are absolutely on top of this and trying to understand the data as much as we can. Elizabeth?
Yeah, it is. There's a lot of moving parts, particularly if you get your vaccine at 2 different locations. It's a little bit more consistent if you get them, say, both at Johnson County Department of Health and Environment, so that when you do that, we have record of your first and then we have record of your second, and both of those go to the state health department. And that's how we get our data that you see on our dashboard, is through the state. Even if you got both of your doses in Kansas, it should be okay. We should have both of those. But sometimes, there's data entry errors. Maybe somebody mistyped a date of birth, or, there's a little letter is off in your name. And so there are instances. I think in particular, though, if you got your first dose, say outside of the state of Kansas, and then you got your second dose, say at one of our vaccine clinics, really checking in to make sure that that first dose is registered, because that's really where we're going to miss it. The other piece too, I would certainly recommend, is if you got both of your doses out of the state, reach out to your healthcare provider. There's a way for them, most of them, and particularly now, to enter that information into the state system. And that's probably where your doctor checked, was to see whether or not you were in there, Teresa. And so that will definitely help. But that's also why you see a difference between the data that we show on our dashboard, and then if you go to CDC, for instance, is because they do document people who received it outside of the state of Kansas. We'll also say too, 8%, I think the media got a hold of that 8% of people who hadn't received their second dose. And it is vitally important to get that second dose, as Dr. Ariola said. But honestly, I'm really excited about a 92% success rate in getting people both doses on time, or fairly close to that. A lot of our other vaccine rollouts, we think about HPV, which is a 3-dose series over a couple of years. That is not nearly as successful at people getting those subsequent doses on time. And so I think it's been great that we actually have achieved 92%. We still need to make sure everybody gets back for that second one, but 92% is probably one of the best uptakes we've had for a 2-dose series of vaccine in such a short period. So I was actually fairly encouraged by that data, as opposed to sort of some of the narrative that you are maybe hearing outside of this.
All right. And before we run out of time, I do want to talk a little bit about this week's special campaign to focus on mothers ahead of Mother's Day. And there's several different parts of that. Part of the focus is on moms themselves getting vaccinated, moms to be, so pregnant women getting vaccinated, and then also kids getting vaccinated as a kind of a gift to their mom, listening to their advice and going to the doctor or getting healthy. So Elizabeth, I know you're part of that campaign. So if you want to talk a little bit about the importance of this.
Yeah, I think vaccines obviously are very important. I sit here twice a week and talk to you guys about vaccines. But for me, look, I was in a very different situation, because being at the health department, I was offered vaccine very early. And so for me, it was really important for a couple of reasons to get the vaccine. One is I have an 81-year-old mother-in-law who has a lung issue. And so at that time, it was really important for me to be protected, to protect her, because it was before she could get the vaccine. But also, honestly, from where I sit at the health department, I read a lot of hospitalization records, a lot of summaries of death for our residents who have died from COVID-19. And, that certainly alters my view about the severity of this illness. I think a lot of times we do look at the big numbers, and I know that a rare event is a rare event, but I've seen the records of, the 30-year-old who's been on a ventilator for 2 months. And I think about their family, and I know that, particularly for myself, in the last year, I would say I've been under a lot of stress. I probably haven't eaten well. I have not been sleeping well. I haven't been doing those things that I know I should be doing to stay healthy, just because of the pandemic. And so for me, it was really important, because I want to be there for my kid. I have had one instance in my life where, since my child was born, where I was scared of not being able to make it through the night. I had a lot of blood loss, and that scared me, and it made it so much more important for me to be around for my kid, because I knew what it would mean in those moments that maybe I wouldn't see him again, or maybe he wouldn't see me. So if I can do this, if I can get 2 shots in a very safe, very effective vaccine, and that means that I get to see my kid, that for me was a big piece too. So, I think that the vaccine is very personal. Maybe it's that you want to go travel to see your mom who lives somewhere else, or, maybe as a grandparent, it's getting that vaccine so you can see your grandkids. All of those were really important things about getting my family vaccinated, to protect my bubble, to protect my parents, to protect my in-laws, some of whom are at higher risk, and then also to protect myself and my family. So Lots of good reasons to get the vaccine, and would definitely encourage anybody to stop on by one of our vaccine clinics or go to local pharmacy's website and sign up for that appointment.
Very well said, Elizabeth. Very well said. And being a mom, couldn't answer that any better. So very well said. I felt the same way with my mom, my 83-year-old mom, living in the suburb of Chicago. I did all that I could to make sure that she got vaccinated as quickly as we possibly can. Didn't see her for over 2 years, partly because of the COVID. And just so that she can see her children, grandchildren, and I can see and hug her, that's very important. So again, for all those moms that are listening to us, happy Mother's Day. It's an opportunity for you to do precisely what Elizabeth has said. Get vaccinated for your sake, your kids' sake, your mom's sake, and make it a gift for your mom, and get vaccinated. What a wonderful time to lay examples, just like you always do at all times. But yeah, I love that the campaign is out. I love that our staff, who are moms themselves, came up with that campaign, and another way to reach out to our moms who really can help drive us to the finish line with this vaccination campaign.
All right. Any other parting words as we close out here today?
Thank you, everyone. Again, I would repeat, I think we have one more show later this week, but I do really want to wish everyone happy Mother's Day. And there are several opportunities to get your vaccine. Go and get it. And to Elizabeth, Allison, Teresa, Barbara, all of you that are here, happy Mother's Day.
Thank you. All right. Well, as you mentioned, we do have one additional Facebook Live event to talk about vaccines, and that one has actually been a little rescheduled. And for this week and the next 3 weeks, we're going to be having the second one of the week on Wednesdays at 9 a.m. So set your alarm clocks, right?
Yes.
If you miss it, you can always watch it again on Facebook, and we also have these on YouTube. So, all right. Well, we will see you all then. Thank you all.